Welcome back to Veterans Health Watch. Joining us now is Dr. Guerra Netzer, an attending physician at the Baltimore VA Medical Center and an assistant professor of medicine and epidemiology at the University of Maryland School of Medicine. Dr. Netzer, thank you so much for joining us.
My pleasure.
So we're discussing asthma and chronic obstructive pulmonary disease. Now, I've heard these terms used in the same conversation. Could you tell us what they have in common?
Sure. So they're both diseases that affect breathing, and in both diseases, it's harder to get the breath out. The breath will come in but get stuck and be difficult. We call that obstruction. There's some similarities between them and also a little bit different. Both of them have an element of inflammation, but the amount of inflammation differs. Usually the age at which people develop it is also different. COPD, as we call chronic obstructive pulmonary disease for short, COPD usually happens in people that are a little bit older, further into adulthood. And in both, the treatments are a little bit different, and some of the medicines that work well in one may not work as well in the other.
Mm-hmm. Dr. Netzer, I understand about 17 million individuals in the United States suffer from asthma. Who's at risk of developing asthma?
Yeah, so we're seeing more and more asthma, as you stated. We're probably seeing it for a couple of reasons. One is the way that we're living changes, and also we're better at diagnosing it. People are at risk of asthma, developing asthma both in childhood and adulthood. We know that certain risk factors are present. For example, if you live in a city, you're more likely to develop asthma than if you're living in the countryside. Also, there are factors in terms of people's own bodies, in terms of whether they have skin conditions or allergic conditions that may also put them at risk for asthma. There seems to be also a relationship between asthma and certain stomach or intestinal problems as well. So we're seeing more and more asthma. People think that asthma is only something that happens to kids. There's certainly kids are an age where people develop asthma, but also we see more during adulthood as well. And during adulthood, women are actually more likely to develop or present with asthma than men.
Well, what are some of the symptoms a person should look for asthma?
So one of the symptoms that people talk about the most is shortness of breath, and after that, wheezing. But not everybody who has asthma recognizes that they're having shortness of breath, and not everybody with asthma wheezes. So certainly, the classic presentation is that somebody feels short of breath and starts to have a wheeze after they come in contact with a pet or something with hay fever or allergies. But there can be a lot of different sensations. Some people feel only a sensation of slight tightness in their chest. Some people feel they can't get another breath in. And some people just notice that during the winters, for example, they'll have a cold that just doesn't seem to go away. They just keep coughing and coughing. And cough is one of the symptoms of asthma that can be just as profound as the shortness of breath or the wheezing.
Dr. Netzer, I understand that COPD is a lung disease. How does one develop COPD?
So we use the term COPD to describe a couple of different diseases that we used to use different names for. We used to talk about emphysema and about chronic bronchitis as these diseases that people mostly associate with smoking. We realize that most people actually have a combination of either emphysema and chronic bronchitis. And so rather than making a distinction or a distinction between the two, we use the term COPD to describe a spectrum of diseases. COPD is most commonly associated with smoking, and the more you smoke, it appears that your risk increases. Not everyone who develops COPD has smoked. There are other risk factors as well. So, for example, people who have wood-burning stoves or use fire for their cooking are at risk. Some people have a genetic predisposition for it. Sometimes people who misuse substances can develop COPD. And for a proportion of people, they develop COPD and we just don't know why.
Dr. Netzer, what types of examinations do you perform at the VA Maryland Healthcare System to determine if a person has asthma or COPD?
The first is to let your healthcare provider know that you're having symptoms, and he or she will take a very careful history, learn more about what's actually causing, which symptoms you're having and what triggers or what causes them. If your primary care provider decides that you should see a lung doctor, as lung doctors there's a number of different tests that we do. And one of them is that we have pulmonary function tests, and those are lung tests in which we have you breathe, and we're able to look at the way your lung moves air, whether your lung traps air, and also how your lung is able to take oxygen from the outside air and bring it into your bloodstream. All those can provide us information, help correlate those results with the kind of symptoms you're having and help determine whether you indeed have COPD or another lung disease.
Dr. Netzer, in an earlier segment we learned about sleep apnea. How does asthma and COPD affect someone who might have a sleep disorder?
So both those diseases can cause real problems with sleep. And it's important also to discuss those with your healthcare provider. In asthma, one of the things that we're most interested in terms of people's symptoms is, do they have symptoms when they're in bed or trying to sleep? Because those can be very severe, and those can be an indication to the doctors and to the other healthcare providers that maybe an increase in therapy is necessary to get the asthma under better control. In chronic obstructive pulmonary disease, or COPD, there can be a number of different sleep problems. One is that people with COPD are as entitled to have obstructive sleep apnea or any other form of sleep disordered breathing or problem sleeping as anyone else. Additionally, a lot of people whose breathing and whose oxygenation who are very good during the day, when they're sleeping, their oxygenation may go down. And that's things that we'd want to know because we'd be able to treat them and improve breathing and reduce the stress on the body and overall improve their quality of life.
So what types of treatment options are available?
So we have some very good medicines both for asthma and for COPD. There's an overlap. Some of the medicines we use for asthma we use commonly in COPD. In asthma, the most important thing is we want people on medications that will help actually control the inflammation that drive asthma. So most people, when they think about asthma medicines, think about a medicine like albuterol, their puffer that'll help them feel better immediately. But the most important thing is to keep it from happening in the first place. So controller medications are the medications that reduce that inflammation. One class is called inhaled steroids. These are steroids that you breathe in through an inhaler or through a disc. Those can help reduce the inflammation and keep the symptoms from starting. There's also additional medications that are available that we can either use instead or in addition to those inhaled steroids to help control asthma well. For COPD, there's some similar medications. We'll often, depending on the severity of people's disease, sometimes we'll just use a puffer as needed. Sometimes we'll use additional medications, including asthma medications. We know that inhaled steroids can reduce the number of exacerbations or flare-ups of people's COPD. And we know that other medicines can be of benefit as well, including longer-acting versions of albuterol that we use in conjunction with the inhaled steroids.
Dr. Netzer, we have a little less than a minute left in this segment, but you've mentioned the medications. Are there other methods or other things that we can do to treat someone who has asthma or COPD?
Absolutely. So medicines are only part of it. One thing in COPD is that we want people to stay active. People think that when they're short of breath that the last thing they should do is be active, and the exact opposite is true. When people are moving, it helps use their muscles and helps them continue and not have a decline or a reduction in what they can do eventually. So there actually sometimes we'll enroll people in pulmonary conditioning programs. Those are special supervised workout programs. We also want to talk to people about making sure that they're eating well, keep their nutrition up. People who have trouble breathing spend more energy doing their work of breathing. And we want to make sure that overall that we're addressing all the other issues in people's health, including just making sure that their oxygen is high enough. And just plain old-fashioned oxygen is one of the most important things for the people who need it.
Dr. Netzer, thank you so much for joining us today and sharing really important information.
Thank you so much. It was my pleasure.
Well, that wraps up this edition of Veterans Health Watch. If you have questions about today's show or would like to make suggestions for future topics, please call us at 1-800-463-6295 or visit us at maryland.va.gov. You can also follow us on Facebook and Twitter. Thanks for joining us.
We look forward to hearing from you soon, and please join us next time.